Welcome back to my channel. If you are visiting this space for the first time, you are also highly welcome. In this channel, we simplify anatomy, and here we also learn anatomy with so much fun. In this lecture, I'll be looking at the internal pudendal artery. Let's try and use this image by the side to illustrate how the internal pudendal artery emerges. This structure that is highlighted here in red is the abdominal aorta. And we know that at the inferior end of the abdominal aorta, we see that it finally bifurcates into the common iliac arteries. So we have the common iliac artery here, carried in purple. This common iliac artery is also seen to further subdivide into the internal iliac artery and also the external iliac artery. This internal iliac artery at this end is seen to divide also into the anterior trunk and also the posterior trunk. This internal pudendal artery is seen to emerge from the anterior trunk of the internal iliac artery. So this is where we have the internal pudendal artery here carried in red as an emergence from the anterior trunk of the internal iliac artery. This is how the internal pudendal artery emerges. So let's go through this lecture to describe the course of the internal pudendal artery and also highlighting the different branches that it gives. Internal pudendal artery, we say that it is one of the terminal branches of the anterior trunk of the internal iliac artery. Let's try and use this image to explain this statement. The structure that is highlighted here in red is the abdominal aorta. The abdominal aorta is seen to terminate at its inferior end into the common iliac artery, and this is what is harrowed here in purple. This common iliac artery is also seen to further subdivide into the internal iliac and also the external iliac artery. So you have the internal iliac artery at this end, and you have the external iliac artery at the other end. This internal iliac artery is seen to also further divide into the anterior trunk and also the posterior trunk. So you have the anterior trunk here harrowed in brown, and you have the posterior trunk here behind harrowed in green. This anterior trunk, of course, is seen to give off a number of branches. We've tried to describe the branches of the internal iliac artery in our previous lecture. If you've not checked that lecture, please kindly go and do so. In that lecture, we explained that the internal iliac artery is seen to further divide into the anterior trunk and also the posterior trunk. Also in that lecture, we described the different branches that are seen to emerge from both the anterior and also the posterior trunk. So focusing now on the anterior trunk, this anterior trunk is seen to give off a number of branches. And at its terminal end, is seen to finally terminate into two branches. So having given off a number of branches along its course, at this terminal end, is seen to divide into the internal pudendal artery and also the inferior gluteal artery. So you have the internal pudendal artery here arrowed in pink, and you have the inferior gluteal artery here arrowed in blue. So you have these two branches as the terminal branches of the anterior trunk of the internal iliac artery. And out of these two branches, you see that the internal pudendal artery is the smaller terminal branch. If you try to compare the caliber of this artery with the inferior gluteal artery, you see that this inferior gluteal artery that is highlighted in dotted blue is seen to be thicker than the internal pudendal artery. And this is why we say that the internal pudendal artery is a smaller terminal branch of the anterior trunk of the internal iliac artery. And it's good for us to be able to illustrate this. This internal pudendal artery is seen as the main arterial supply of the perineum. And we know that the perineum is located inferior to the pelvic floor or the pelvic diaphragm. We've tried to also describe it in our lecture on the perineum. The perineum is a space that is seen at the inferior part of the pelvic floor or the pelvic diaphragm. In that lecture, we also describe a number of organs that are located within the perineum. And these organs, of course, will need to be supplied with oxygen and nutrients. So it is branches from the internal pudendal artery that are seen to supply the viscera that are located within the perineum. And as we go through with this lecture, by the time we'll be highlighting the different branches from the internal pudendal artery, you would see that these branches are supplying structures or organs that are located within the perineum. So the internal pudendal artery, after its emergence, it is important for us to establish the course that it runs. We already described how it emerges from our previous slide. We say that it is an emergence from the anterior trunk of the internal iliac artery. We try to use this image by the side. This is where we have the anterior trunk of the internal iliac artery, because we know that the internal iliac artery will further subdivide into the anterior and the posterior trunks, where the different branches will then emerge from. We say that at the terminal end of the anterior trunk, we have the internal pudendal artery, and this is what is highlighted here in pink. So you have this as one of the terminal branches. Remember, we say that we have two terminal branches from the anterior trunk of the internal iliac artery. The second branch is the inferior gluteal artery. But because we are focusing on the internal pudendal artery, that is why we are only highlighting this branch in this slide. So after it emerges, it is seen to run three courses. So it is seen to run the pelvic course, it is seen to run the gluteal course, and it is seen finally to run the perineal course. We know that the internal pudendal artery emerges from the anterior trunk of the internal iliac artery. This emergence is within the pelvic cavity. Of course, it is going to be seen to run a short pelvic course around the space. And the main aim of this pelvic course is for it to exit the pelvic cavity. Remember in our previous slide, we said that the internal pudendal artery is seen to supply the perineum. And the perineum is a region that is located inferior to the pelvic cavity. So it needs to exit the pelvic cavity so as to be able to access the perineum. And this is the essence of running this short pelvic course to find its way out of the pelvic cavity. As soon as it exits the pelvic cavity, the region that the internal pudendal artery would find itself is the gluteal region. And of course, within this space, it's also seen to run a gluteal course. And the essence of this gluteal course is for it to be redirected back into the perineum, where it is going to be giving up branches to supply different structures within the space. So that means finally, it is going to be having the perineal course, which of course is a region where it will be giving off its branches to supply the different organs that are located within that region. So we are going to be taking the different sub-regions, of course, relating to the course that it runs, establishing the events that occur around this space, and finally highlighting the different branches that we have. So for the first course is the pelvic course of the internal pudendal artery. So after its emergence, it is seen to run a short pelvic course. And this pelvic course is directed inferior laterally and is driven towards the inferior region so as to be able to access a foramen through which it will exit the pelvic cavity. If you try to use this image by the side, this is where we have the anterior trunk. So this is where we have the posterior trunk behind. So from the anterior trunk, we have the emergence of the internal pudendal artery, and this is what is arrowed here in pink. So you have this artery as it emerges, you see that it is directed laterally and also driven inferiorly, and for it to be able to access the foramen through which it will exit the pelvic cavity. So after its emergence, it is seen to cross two structures. So it is seen to cross the sacral plexus, and it is also seen to cross the piriformis muscle. We try to use this image here, this structure that is highlighted here in white is the sacral plexus. We know that the sacral plexus is a collection of nerves that is located at the posterior region of the pelvic cavity. We also have the piriformis here that is highlighted in yellow that is also seen to be positioned around the posterior pelvic wall. So you see that after the emergence of the internal pudendal artery from the anterior trunk of the internal iliac, it is seen to cross the sacral plexus and also the piriformis. And after crossing these two structures, you see that it is directed towards the greater sciatic foramen. And this is how it's able to exit the pelvic cavity. Let's try and use this image by the side to further explain or illustrate how it runs within the pelvic cavity. So this is where we say we have the greater sciatic foramen. This greater sciatic foramen is located on the lateral side of the pelvic cavity. And this is why this vessel is directed inferior laterally. So at this inferior region, you have the sacrospinous ligament. This sacrospinous ligament is seen to bound the greater sciatic foramen at its inferior end. This is what actually transforms the greater sciatic notch into the greater sciatic foramen. So you have at this inferior end, you have a border that is created inferiorly by the sacrospinous ligament. And this is what is harrowed here at this point. This sacrospinous ligament, as I've always said on this channel, is always break down the name. sacrospinous. It means it's the ligament that runs from the spinous process of the ischium, and this is where we have the spinous process of the ischium, and is directed to be inserted on the sacrum. And this is where we have the sacrum here at the posterior end. So you see the sacrospinous ligament running to and fro these two specific regions. And at this point, you see it forming the inferior limit of the greater sciatic foramen. So you have a foramen created at this point. And of course, at this posterior region here, you have the sacral plexus. This sacral plexus is seen to be highlighted here in white. The sacral plexus, we say that it is a collection of nerves located or positioned around the posterior pelvic wall. We also have the piriformis. The piriformis is a muscle that is seen at the posterior pelvic wall. And you see the fibers of this muscle emerging from the anterolateral surface of the sacrum. So this is where it emerges from. And you see the fibers of the piriformis directed through the greater sciatic foramen. And if you look at this image, you see that it is directed through this greater sciatic foramen. And this is how the piriformis exits the pelvic cavity. And you see the fibers exiting it and finally inserted on the greater truncator of the femur. We have the femur on this outer region where the head fits into the acetabulum. So you see that this piriformis muscle emerging from the posterior wall of the pelvic cavity is finally seen to be inserted on the greater truncator that is located around the head of the femur. So you see that this muscle will also need to pass through the greater sciatic foramen for it to exit this region and be inserted on the greater truncator of the femur. So you have this presentation presented on the background. Then finally, when we have the emergence of the internal pudendal artery, and this is what is highlighted here at this region, you see it crossing the sacral plexus and also crossing the piriformis. And the pattern by which it crosses these two structures, you see that it is tilted or directed towards the inferior region of the piriformis. And at this region is where it accesses the greater sciatic foramen. If you look at the pattern by which the piriformis itself runs through the greater sciatic foramen, you see that this muscle is seen to further divide the greater sciatic foramen into an inferior region and also a superior region. So you have an inferior region here that is harrowed at this point that is referred to as the infrapiriform foramen. Then you have another region above that is referred to as the suprapiriform foramen. So you see that the piriformis, in the course of passing through the greater sciatic foramen, is also further helping to subdivide this foramen into two subforamina. So you have the infrapiriform foramen and also the suprapiriform foramen here above. So the internal pudendal artery is directed specifically through the infrapiriform foramen. And this is where it will be exiting the pelvic cavity. So this is the dramatic event that the internal pudendal artery exhibits within the pelvic cavity. This is a short course, but it's good that we're able to highlight it in details, the structures that are related to it. So this is how it runs. So you see it being directed specifically through the infrapiriform foramen, which of course is a subset of the greater sciatic foramen. It's as a result of the part that the piriformis exhibits within this foramen. And the aim of the pelvic pulse is for it to be directed through the greater sciatic foramen, specifically through the infrapiriform foramen, which of course is a subset of the greater sciatic foramen, for it to be able to exit the pelvic cavity. So at this region, you see that it is directed to the point where it will be exiting the pelvic cavity. So this is the pelvic pulse. And upon exiting the pelvic cavity, this will take us to the next region that it will find itself. And this is the gluteal region. So in the gluteal region, we have the cause that it also runs within this space. So if you try to use this image by the side, this is where we have the internal pudendal artery arrowed here in pink. At this point, it is directed towards the infrapiriform foramen, of course, a subset of the greater sciatic foramen. And after its direction towards this space, it finds itself within the gluteal region. In the gluteal region, it is seen to wind around the posterior aspect of two structures. It is seen to wind around the posterior aspect of the ischial spine and also the sacrospinous ligament. If you try to use this image by the side to further illustrate how it winds around the posterior aspect of these two structures, this region that is harrowed here in black is where we have the greater sciatic foramen. This greater sciatic foramen, we say that it is inferiorly limited by the sacrospinous ligament. We already established that the sacrospinous ligament is a ligament that is seen to run from the spine of the ischium to the sacrum. And this is how the name is being drafted, sacrospinous ligament. Then you also have the sacral plexus at this posterior end. Then we have the piriformis. We say the piriformis also packed through the greater sciatic foramen to exit the pelvic cavity, where its fibers will be inserted finally on the greater truncator of the femur. So we have the emergence here of the internal pudendal artery. And you see that this internal pudendal artery is directed towards the infrapiriform foramen, of course, a subset of the greater sciatic foramen. So this is where it is directed. And from this region, after exiting this point, it is positioned within the gluteal region. In the gluteal region, it is seen to wind around the spine of the ischium and also the sacrospinous ligament. Remember, this is where we have the spine of the ischium that is harrowed in blue, and this is where we have the sacrospinous ligament here that is harrowed here in brown. So you see it winding around the posterior aspect of these two structures. And the aim of winding around the posterior aspect of this structure is for it to be redirected back into the lesser sciatic foramen. We also have a lesser sciatic foramen that is formed at this inferior end, that is formed as a result of transformation of the lesser sciatic notch into this lesser sciatic foramen by the sacrotuberous ligament. But this we have also highlighted in our previous lecture on the pelvic ligaments. So you have it winding around these two structures for it to access the lesser sciatic foramen. And it is through the lesser sciatic foramen that is able to access the perineum. So the next region where you'll be seeing the internal pudendal artery, after winding around the posterior region of the ischial spine and the sacrospinous ligament, is the lesser sciatic foramen. So from the lesser sciatic foramen is able to gain access into the perineal region. So the next region is the perineal region. So let's say the cause that it also runs around the space. So this is where we say we have the internal pudendal artery in this image. So this internal pudendal artery, after exiting the pelvic cavity through the greater sciatic foramen, it is seen to re-enter back through the lesser sciatic foramen. So if you try to use this image here, we have the internal pudendal artery here exiting the pelvic cavity, of course, winding around the posterior aspect of the ischial spine and the sacrospinous ligament. And from there, it is seen to be redirected through the lesser sciatic foramen. It is seen to then find itself within the perineum. Upon entering into the perineum, it is directed into the Halcus canal or the pudendal canal. The Halcus or the pudendal canal is located on the lateral region or lateral aspect of the ischial fossa. This is located around the posterior region of the perineum. This means that the internal pudendal artery will enter the perineum through its posterior region. So around this space, you have the Halcus canal or the pudendal canal, and this is where the internal pudendal artery is directed into. Within the pudendal canal, it is seen with the corresponding named vein and also the pudendal nerve. So let's try and go through the next slide where we'll be establishing the different branches that it gives upon it re-entering into the perineum. So if you try to use this image by the side here, this is where we have the pudendal canal. And by now, we know that the internal pudendal artery is located here within the pudendal canal. And this is what is highlighted here in yellow. Before we start to highlight the different branches that it gives, let's try and highlight the different structures that are located around the pudendal canal. Remember, we stated in our previous slide that the pudendal canal is located around the posterior region of the perineum. Specifically, it is located on the lateral region or side of the ischial fossa. We know that the ischial fossa is the fossa that is created on both sides of the opening of the anal canal. So at this posterior end on the lateral side, we have the pudendal canal. And this is what is highlighted here in blue. We have two. We have one on this side and we have another one on the other side. So we have it on the lateral region of the ischial fossa. If you go more anteriorly within the perineum, this region that is harrowed at this point, we have the deep perineal pouch. So this is where we have the deep perineal pouch. This deep perineal pouch is located in the anterior part. And of course, if you look at it at the inferior region here, it is limited or guided by the inferior fascia of the urogenital diaphragm, which can also be referred to as the perineal membrane. And this is what is highlighted here in blue. We've also tried to describe this in our previous lecture on the deep perineal pouch. If you go more inferiorly at this region that is harrowed at this point, is where we have the superficial perineal pouch. This superficial perineal pouch is also located in the anterior region. These two pouches, which include the deep and the superficial perineal pouches, are located in the anteriorly placed urogenital triangle. So we should expect that they will be positioned in the anterior part of the perineum, while posteriorly behind is where we have the pudendal canal. Of course, within the pudendal canal, we have the internal pudendal artery, and this is what is highlighted here in yellow. And if you look at the alignment of these structures, you see that they are located within the perineum. We already said that the perineum is a region that is located inferior to the pelvic floor or the pelvic diaphragm. So if you have the pelvic cavity up here, and of course it's limited inferiorly by the pelvic floor, the pelvic diaphragm, inferior to the pelvic floor, the pelvic diaphragm is then where we now have the perineum. And we've tried to establish the different structures within the perineum and also position them in their normal anatomical place. So you see that you have the pudendal canal at this posterior end, while in the anterior end, you have the deep perineal pouch in the upper part, and in the more superficial part in the anterior region, you have the superficial perineal pouch. So now let's try and highlight the different branches that would emerge from the internal pudendal artery. The first branch that would emerge is the inferior rectal artery. If you go back to this image, the structure that is highlighted here in yellow that is located within the pudendal or the Alcus canal is the internal pudendal artery. So you see it giving off a branch within the pudendal canal, and this is referred to as the inferior rectal artery. This inferior rectal artery is seen to supply the inferior region of the rectum. Remember, we also have the superior rectal artery that is a branch from the inferior mesenteric artery. And we also have the middle rectal artery that is one of the direct branches from the anterior trunk of the internal iliac artery. We've tried to establish these arteries in our previous lecture on the internal iliac artery, but for us to know that the first branch that internal pudendal artery would give within the pudendal canal is the inferior rectal artery. And this is what is highlighted here in this region. And from the name, we should know that it will be giving supply for the inferior region of the rectum. So you see that the internal pudendal artery will then proceed in its course. And at this region, after giving up the inferior rectal artery, you see the emergence of the perineal artery. And this is where we have the perineal artery here emerging at this point. This perineal artery, after its emergence, it is further subdivided into the posterior scrotal artery or the posterior labial artery in female, and also the transverse perineal artery. So you see that the perineal artery is further subdivided into two. If you drive deep on the emergence of the perineal artery from the internal pudendal artery, you see that as it emerges, it is not seen to be directed into the deep perineal pouch. At this region, just at the point of entering the deep perineal pouch, you see it piercing the posterior region of the perineal membrane that is highlighted here in blue. Remember, we said that the perineal membrane is the inferior limit or the membrane that is covering the deep perineal pouch at its inferior limit. So you see it piercing the inferior edge here of the perineal membrane, and this is where it is seen to further subdivide into the posterior scrotal artery in male or the posterior labial artery in female, and also the transverse perineal artery. So you see that this perineal artery is distinct in its own way. After emerging, it is seen to be directed into the superficial perineal pouch. And this is where we have the superficial perineal pouch here, where it will be giving supply to the posterior region of the scrotum or the labial tissue, and also the transverse perineal artery. Then after this emergence, the next branch that we have is the artery of the bulb of the penis or the artery of the bulb of the vestibule. And this is what is seen to emerge at this point. You see that we have the internal pudendal artery, having given up the inferior rectal and also the perineal arteries. It is seen to give up the artery of the bulb of the penis or the artery of the bulb of the vestibule. And if you look at the distinct part that it runs, you see that this artery is directed into the deep perineal pouch. So you see it directed into the deep perineal pouch and turning to pierce the perineal membrane. We say that the perineal membrane is highlighted here in blue, and it's seen to form the inferior limit of the deep perineal pouch. As a matter of fact, it is the inferior fascia that is seen to cover the urogenital diaphragm inferiorly. And we know that the urogenital diaphragm can also translate to the deep perineal pouch. This was what we highlighted in our previous lecture on the deep perineal pouch. You can also go and check that lecture up. So you see that the emergence of the artery of the bulb of the penis is seen to pierce through the perineal membrane for it to access the superficial perineal pouch. And what this means is that the artery of the bulb of the penis or the artery of the bulb of the vestibule is seen to pass through the deep perineal pouch and also the superficial perineal pouch, considering the pattern by which it runs. So you see it after it emerges from the internal pudendal artery, it is directed into the deep perineal pouch, of course, taking a turn so as to be able to access the superficial perineal pouch. And the only way to do this is by piercing the perineal membrane. You also have another emergence that runs the same course, and this is the urethral artery. This is where we have the emergence of the urethral artery also directed into the deep perineal pouch, also making a turn to be directed into the superficial perineal pouch. And you also see this vessel also piercing the perineal membrane. You also have the deep artery of the penis or the deep artery of the clitoris also running this same course. And this is how it also runs, and it is seen to be directed into the deep perineal pouch, making a turn, piercing the perineal membrane so as to access the superficial perineal pouch. Then the last branch that you have of the internal pudendal artery is the dorsal artery of the penis or the dorsal artery of the clitoris. This is the final terminal branch, and you see that this branch also presents a distinct pattern. After the emergence from the internal pudendal artery, you see that it is seen to run just through the deep perineal pouch, and this is where it is seen to pierce the perineal membrane in the anterior region, where it will be supplying the dorsal region of the penis and also the clitoris. So you see that the different branches of the internal pudendal artery runs different course as it relates to the deep and also the superficial perineal pouch. So if you try to group this, so you see that the first branch, which is the inferior rectal artery, this inferior rectal artery has a distinct pattern because it is the only artery that is seen to emerge within the pudendal canal. Then you also have the perineal artery. This perineal artery is also distinct in its own way because it is only seen within the superficial perineal pouch, and it is also because of the pattern by which it runs. After it emerges from the internal pudendal artery, it is seen to be directed into the superficial perineal pouch. It is not seen to be directed into the deep perineal pouch like the other branches. It is seen to just pierce the posterior region of the perineal membrane where to be accessing the superficial perineal pouch. Then you have another group of vessels that emerge from the internal pudendal artery, and this is where we have the artery of the bulb of the penis or the vestibule, the urethral artery. We also have the deep artery of the penis or the clitoris. These three emergences are seen to run through the deep and also the superficial perineal pouch. And this is as a result of the pattern by which they run. If you look at how they run, we have these three vessels here highlighted in red. You see that they are directed into the deep perineal pouch, and they are seen to make a turn where they will be piercing the perineal membrane so as to be able to access the superficial perineal pouch. So you can see that they run through the deep and also the superficial perineal pouch. Unlike the perineal artery that is seen to only be contained or seen within the superficial perineal pouch. Then you also have the last set, which is the dorsal artery of the penis or the dorsal artery of the clitoris. This is what is seen to be highlighted here in black. This artery is only seen to be contained within the deep perineal pouch. So you can see that these arteries, of course, depending on how they emerge and also the course that they run, will determine whether they will be positioned or seen within the deep or the superficial perineal pouch, or they will be seen in both the deep and also the superficial perineal pouch. Then we also have another exception, which is the inferior rectal artery that is seen as an emergence of the internal pudendal artery while it is still located within the pudendal canal. So thanks for watching. Let's continue to stay glued to this channel.